recording later on after everything is presented. So with that, we'll go ahead and get started. The first thing I want to mention is why we're spending so much time focusing on calf care management. This stage is really important because calves, especially newborns, are highly susceptible to many stressors that can have lasting impacts later on. They're really susceptible to diseases, either bacterial or viral, parasites, as well as temperature stress. And events that occur during calfhood can set the stage for the rest of the animal's life. So something negative that happens early on in the calf's life can have negative implications on calf performance later on down the road. So the first major event in the calf's life, obviously, is birth, and that is a seriously critical point in the calf's life. So we're going to spend quite a bit of time talking about some management things that need to be done during the first 24 hours. I can't stress enough how important it is to make sure that calves get adequate amounts of good quality colostrum. So colostrum is the first milk from the cow that is rich in antibodies, proteins, and growth factors. And it's important for helping the calf's immune system to develop. So calves are basically born with a naive immune system, so they don't have basically any immune system, and that colostrum is really important to helping them develop antibodies to different diseases. It was once thought that colostrum its sole purpose was to provide antibodies to the calf, but recent research is also looking at the importance of those proteins and growth factors that are in colostrum, because they have a role in helping the calf's intestine actually mature and absorb nutrients more efficiently. So the calf's ability to absorb antibodies begins to decrease after birth. This figure here on the right shows the absorption of immunoglobulins or antibodies after as the calf ages. So from 0 to 24 hours, you can see that there is a dramatic decrease in the absorption rate of antibodies, and it's basically non-existent at 24 hours after birth. That's why it's so critical to ensure that calves get colostrum within a timely fashion after birth. Inadequate colostrum consumption can lead to a poorly developed immune system, which predisposes calves to a host of different conditions, including calf scours, respiratory diseases, or general unthriftiness or poor health. This figure is showing, again, the importance of how soon after birth a calf gets colostrum and its effect on the concentration of antibodies in the blood and how well the calf is absorbing those antibodies. This figure is showing the top line here with the diamonds. The darker line is showing the response for calves that were given colostrum right at birth, and the rise that you see in blood antibody concentration is shown here. The lighter colored gray line with the boxes shows the antibody concentrations when calves were given colostrum at 6 hours after birth, and the triangle line is showing antibody concentrations when calves were given colostrum 12 hours after birth. So you can see there's a pretty stark difference, and it was statistically significant difference between calves that were given colostrum right after birth versus calves that were given colostrum at 6 or even 12 hours after birth. So the take home from this is just that early colostrum consumption is really critical to helping calves get off to a good start. So there are a couple different ways you can ensure colostrum intake of your calves. Obviously, we're not going to be hand feeding all of these calves colostrum. Hopefully the cow will do that for us. But it's important to closely monitor your cows that are close to calving. Not only is this important for detecting signs of problems during calving, as Rachel addressed in our webinars last month, but it's also important for being able to determine roughly how old that calf is. So you know how long it's been around, and if it hasn't nursed yet, you know when you might need to step in. Calves should be up and nursing within 4 hours of birth. If you are not there and actively see them nursing, there are a couple other things you should look for to indicate whether or not the calf has nursed. You can look for, on the cow's udder, you can look for clean, slick teats, matted hair and saliva around the teat, or 1 or 2 teats that might be smaller than the others that would indicate that the calf may have nursed. You should also look for a vigorous active calf. A calf that is not nursed is after a specified period, an extended period of time is generally not going to be, super vigorous and up and running around, versus one that is. Your best bet is that calf probably did receive adequate colostrum. A calf that appears lethargic or weak about 4 to 6 hours after birth probably hasn't nursed well. And at this point, it's probably a good idea for you to step in and help. And we'll talk about that here shortly. Calves that have endured a difficult calving or whose dams are thin or whose dams are first calf heifers may also require assistance or supplemental colostrum. So if a calf has been through a difficult calving, it might be more lethargic than normal. So it might not be able to stand and nurse quite in a timely fashion. Cows that are thin or first calf heifers oftentimes struggle to produce adequate amounts of quality colostrum. So those are instances where you might need to provide supplemental colostrum. So you might be wondering, well, what if I have a situation where the cow won't let the calf nurse? Well, in those situations, we recommend restraining the cow and helping the calf nurse. So it's important that this is done in a safe manner. If you have a chute or a head gate, generally that's recommended to restrain the cow. And then if you don't have a chute with a side opening door to let the calf access the udder, you can secure the cow's back legs to help prevent the cow from kicking the calf. After attempting this a few times, it's a good idea to keep the pair separate from the rest of the herd for a few days to encourage bonding. So you can keep them in a separate paddock or a separate, a pen inside the barn or what have you. It's just important that wherever this separate pen is easy for you to access and observe, because you do want to keep a close eye on them to make sure that the calf is still able to nurse the cow. If it appears that the calf's not able to nurse the cow still after a couple of hours, it's important to keep assisting several times a day if necessary. And if a successful feeding isn't established by that 4 to 6 hour mark after birth, it's important that you do step in to feed the calf colostrum or colostrum replacer to ensure that the calf gets those antibodies that it needs. So what if the calf can't nurse? So potential reasons for this might be a difficult birth. We kind of already mentioned that, and that might make the calf lethargic. If the cow refuses a calf and you either can't get the calf to nurse the cow, or you can't restrain the cow appropriately to get the calf to nurse, or the cow has died or something has happened, what should you do? Well, it's important that the calf does get colostrum, so you should feed it via a bottle or an esophageal or tube feeder. So bottle feeding a calf is pretty self-explanatory. We're not going to go into too much detail about that. But an esophageal feeder is something that a lot of folks sometimes get nervous about. So we're going to spend a little bit of time talking about that. So the tube feeder is important for delivering nutrients to a calf that can't or won't nurse a cow or a bottle nipple. So if a calf can't or won't nurse, it's important to, one, get colostrum into the calf if it's under 24 hours old, but also if you have a situation where it's a sick calf, you might need to provide hydration, so electrolytes and things like that. And that might be another instance where you would need to use an esophageal or tube feeder. What you're going to be using the tube feeder to deliver is going to be colostrum or colostrum replacer in that first 24 hours, or electrolytes for a calf that's older and that might be sick or dehydrated. There are two basic parts to a tube feeder. There's the bottle or the bag, which is what holds the milk replacer or the colostrum replacer. And then there's the probe, which can either be metal or plastic. And on the end of the probe is a rounded end here, which helps to, helps it pass down the calf's esophagus. So I'm going to go through a couple of steps that you need to follow in order to use a tube feeder successfully. If this is a skill that you want to develop, which I recommend that everybody who has cows calving is proficient in using a tube feeder in case you do need it, it's a good idea to either practice or have someone who is proficient in tube feeding help walk you through it if you're a little bit nervous about it. The first step is to inspect the feeder to make sure that it's clean and free of damage. Damage can prevent proper delivery of the colostrum, And if it's not clean, you can be introducing harmful bacteria to the calf. And obviously it doesn't really have an immune system yet, and you really don't want to be doing that. So it's really important that it's clean. The second step is to prepare the solution. So in our case that we're talking about today, it's going to be either colostrum or colostrum replacer. In instances where you have a sick calf, you're going to be giving electrolytes, and that you'll just mix according to the instructions on the package. The third step is going to be secure the calf. And the first thing you need to remember about this step is that you need to make sure that it's a safe environment for you. So the cow either needs to be in a separate pen or it needs to be restrained so that it's not going to come after you if it sees you fussing with its calf. Ideally, you want the calf to be standing up or at least sitting up. A calf that's laid outside flat on its side should not be tube fed. If the calf is standing, it's always helpful to back it into a corner so that it can't really move around too much while you're trying to tube feed it. So the fourth step is the one that everybody kind of gets nervous about, and that's inserting the probe. So when you insert the probe, you want to make sure that the nose is in a natural position. So it's level with the ears or below the ears. And you want to insert the probe slowly and gently. And then as you do that, the calf should swallow it and it should move pretty easily after that. It's a good idea to check proper placement after you insert the probe. This can be done by feeling the side of the calf's neck. And if you can feel the end of the probe, then you're in the right place. The trachea is pretty solid tissue, so you won't be able to feel the probe if you go into the trachea, and the calf also might be coughing if you get into the trachea as well. So once you check proper placement, you're good to go. But before you do check your placement, it's important that you do keep the tube or bottle or bag kinked or below the end of the probe, so you're not pouring liquid into it until you're sure that you're in the right place. The fifth step is to deliver the colostrum or colostrum replacer. So you want to unkink the tube and raise the bag or the bottle above the probe to allow flow. And don't worry if the calf fights, as long as you check proper placement to the beginning, it's going to the right place. And you should deliver the entire contents of the bag or the bottle. Step 6 is to remove the probe. So you want to do this really gently. You don't want to just, yank it right out. But when you do this, you should keep the calf's head in a natural position. So again, with the nose below the ears when removing the probe, as the same as when you inserted it. And then the last step is to clean the probe and the bag or the bottle so that it's ready to go for the next time. Again, so if you're interested in learning how to do this technique and you feel a little unsure, it's okay. But please do ask for help and have someone coach you through it if you need to. So you might be thinking, well, if I can't get the calf to nurse, where am I going to get this colostrum from? Well, it's always a good idea to have a plan. We recommend that folks have some extra colostrum stored or a colostrum replacer on hand during calving season in case you need it. So you can obtain colostrum directly from the cow that just calved. But the caveat with this is that you must have the ability to restrain and milk the cow, and not everybody has those capabilities or facilities to accommodate that. So if that's not an option, you can use stored colostrum or colostrum that's been frozen from another cow. Ideally, this would be one from your herd, because that colostrum would have antibodies to illnesses that might naturally occur in your herd. But it can also be from dairy or beef cows from other herds. So if you have a neighbor that has a dairy farm, you can contact them and see if they would give you a couple aliquots of colostrum that you could store in your freezer, and that would be just fine. The third option is to have colostrum replacer on hand. So this is a product that's different from milk replacer. I always like to highlight that it is different. It's more expensive, but it's different from my milk replacer, and it's not necessarily as effective as natural colostrum in getting that immune response in calves, but it's better than nothing. So my recommendation is to have a couple aliquots of frozen colostrum in your freezer during calving season, just in case you need it. And if you don't, if you don't have enough of that, you should always have a couple bags of colostrum replacer on hand too, just in case. So how much colostrum should be fed? So as a general rule of thumb, you want to feed about 5 to 6% of the calf's birth weight as colostrum. So just as a note, a quart is about 2 pounds. So a 70-pound calf would need about 2 quarts of colostrum per feeding. So if you're supplementing colostrum, or if you're doing the feeding of the colostrum, again, we want that first feeding within the first 4 to 6 hours. And then if the calf still hasn't been up and nursed the cow by itself, you want to make sure you get a second feeding of colostrum in that calf within the first 12 hours. Excuse me. If you are using colostrum replacer, you just want to follow the directions, the mixing instructions on the bag. They'll have suggestions as to how much water to add to the powder mixture. The next thing you want to make sure you're paying attention to is making sure the calf is clean and dry. So naturally, a cow will lick the calf clean after birth, which stimulates calf activity. It makes, stimulates the calf to get up and actually nurse. And it also helps to dry the calf and reduce cold stress. So if you think about it, even on a warm day, the calf is going from inside the dam, it's 101.5 degrees, and it's going outside. So even if it's a 70-degree day, it's still kind of a bit of a change for the calf. So drying it off is really important to help prevent that cold stress. If the cow cannot or will not clean the calf off, or if it's really cold weather, you can also help by drying the calf with clean towels. And it's a good idea to keep the calf in a dry, clean area protected from wind at that point, especially if it's cold weather. Heat lamps can also be useful in cold weather, but it's important that you are always around when you're using them. We don't want them touching the calf. You don't want them touching the bedding, because that does pose a risk for a fire hazard. So when you're not around, turn the heat lamp off. We don't want any barn fires. Another thing you want to look at during the first 24 hours is disinfecting the navel. Once the umbilical cord is severed during the birthing process, that provides a direct access way for bacteria to enter the calf's bloodstream until the tissue dries up and falls off. So we want to disinfect the navel, because that does reduce the bacterial load on the tissue itself, but it also helps the tissue dry up faster and fall off. So it reduces that risk in a quicker fashion. In terms of what to use, the industry standard is to use a 7% tincture of iodine within 24 hours. There are iodine-free dips out there, and those work just fine too. But just follow the directions on the label in terms of what it's used for, and if you need to dilute it or not. When we dip the calf's navel, it's generally recommended to use a cup or a shallow bowl or something to that effect, so you can make sure that you get full and complete coverage of the tissue. A no return teat dip cup like this works really well. A little disposable cup also works well. It's just really important that you do clean those in between calves, so you're not transferring pathogens that way. The sprays that they sell with disinfectant are really convenient, but it's really difficult with sprays to make sure that you get full and complete coverage of the tissue. So that's why we recommend the no return cup or something to that effect. The next thing we want to consider during that first 24 hours is identifying calves. This is really, really important for record keeping. Obviously, for a young calf, the easiest and most common thing to do is to use an ear tag. And then obviously when the calf gets a little older, you can either use a tattoo or a freeze or a hot brand for a more permanent type of identification. So it's important that you put at least the calf's number on the ear tag. Some other helpful information to put on the tag include, the dam's name or the calf's birthday and what have you. But again, the identification of the animals is really important for record keeping. So some things you want to make sure you have on hand during calving season. So this is in addition to Rachel's calving kit that she talked about last month. You want to make sure you have a bottle, at least with a 2-quart capacity or more. You want to make sure you have a bottle nipple that's in acceptable condition. So this one here on the left is acceptable. The one on the right is unacceptable because the opening is very large. You don't want milk to be pouring down the calf's throat if it's not actually suckling. You want to make sure you have an esophageal feeder or a tube feeder, and you want to make sure you know how to use it. You want to make sure you have some sort of backup for colostrum. So you want either frozen or stored colostrum or colostrum replacer. You also want to make sure you have your identification methods in place. So you want an ear tag or a tagger. And you also want to make sure you have navel dip as well as clean towels in case you need them. So a few things to look for during those first weeks in terms of making sure calves are doing well. The first thing you want to look for is behavior. So calves should appear vigorous and they should respond to you when they see you, and they should be alert. If they're lethargic or they isolate themselves, they should be examined a little bit closer for potential issues. So you should also be looking for signs of scours or calf diarrhea. So this would be loose, very watery manure. Oftentimes it smells really bad. And you might see the calf's hind end might be covered in very wet manure on the backside. This is different from manure that, comes out that's loose from cows once they're, first turned out into green pasture. This is just foul smelling diarrhea. You also want to look out for signs of dehydration. And this is particularly if you have a calf that has scours or that diarrhea, or if a calf isn't nursing well from the cow, you want to watch for signs of dehydration. You can look at the calf's eyes. So if the eyes are kind of sunken in, as shown in this picture here, that would indicate that the calf needs fluids, generally an IV, or if it's really severe, it'd be an IV. If it's not as severe, it would be electrolytes given orally. But you could also, if the animal's in a chute or you're able to get close to it, you can also do what we call a skin pinch test, where you basically do a pinch like this shown in this picture here, and you tent the skin and let it go, and then you count how many seconds it takes to go flat again. If it takes more than 5 seconds to return to normal, then at that point we would consider that animal to be dehydrated. So those are a few things that you want to be sure to look out for during those first couple weeks. All right, so we're going to switch gears and talk a little bit about nutrition and feeding during that pre-weaning period. And before we get too far into it, I just want to briefly go over how a calf's rumen develops from birth until maturity. So when the calf is born, the rumen, which is for a mature animal, is the largest compartment of the stomach that allows the cow to utilize forages. The rumen is only about 25% of that stomach capacity in a 1-week-old calf. The abomasum, which is that fourth compartment, or the true stomach of the calf or of the animal, is about 60% of the stomach capacity. So when the calf's born at 1 week old, they're functioning much more like a monogastric animal, so like a pig or even humans, because most of their digestion is going to happen in this true stomach, which is very similar to ours. As the calf gets older, the rumen begins to develop, and it can start to utilize forages, because the rumen is what is important for utilizing and digesting forages. And then at maturity, the rumen is fully functional. It makes up about 80% of the stomach capacity, while the abomasum only makes up about 8%. So the calf that is 1 week old generally is functioning like a monogastric. As it gets older, the rumen starts to develop, and it can actually start utilizing forages as part of its nutrition program. And then once they reach maturity, they will fully be able to utilize forages to obtain their nutrients. So for those first 2 months before the rumen's really getting going, calves are going to receive most of their nutrients from milk and not grass or not forage. And the way to make sure that calves are going to be getting enough milk is to make sure that the cow is being fed well. And we're not going to go into too much about body condition scoring, but one of the ways to assess your cow nutrition program is to look at body condition of your cows. So we want to make sure our cows are in adequate condition so that they are primed to produce enough milk for those calves, especially in those first couple months when they can't really rely on solid feed. So we're not going to go into too much detail about body condition, but we want to be looking at the cow's back, her ribs, her hooks and pins, her tail head, as well as her brisket. And if you have further questions about how to body condition score and want more details on that, we can certainly provide that material to you. So, but that's just kind of what and a quick overview of what I just wanted to mention today. In terms of body condition for beef cattle, it's a score of 1 to 9. We ideally want our cows to be calving in between a 5 and a 6. And then during early lactation, they might dip down into a 4 while they're nursing that calf. But we definitely don't want our cows to be down into the 2 and 3 area. So if you see cows that are like that, it might indicate that they might not be producing enough milk for the calves, especially during those first 2 months. So obviously that would have implications for cows being able to be rebred on time and whatnot. So we could talk about body condition scoring for another hour, but we're not going to do that. I just wanted to give you an idea of things to look at in the cows to make sure that they're able to produce enough milk for the calves. During those first 2 months, while they're relying mostly on the cow's milk for their nutrition, calves are going to start to nibble and explore a little bit. So herd behavior really encourages feed exploration. So they're going to be watching other cows. They're going to be watching other calves, graze the pasture or nibble at the hay feeder. So they're going to start doing those things as well. That early feed intake does help to initiate rumen development and get that big rumen compartment starting to mature. And it also introduces helpful bacteria to the rumen as well to get things going. So during those first 2 months, you really want to make sure you're checking the calves each day to make sure they're still active. So poor growth or poor vigor, if they look like they're not doing well, that might indicate they're sick or they're having poor milk production, or they're not able to consume enough milk from the cow. And then at that point, you might want to look at the cow as well to see if there's something going on with her. So from 3 months to weaning, so I have our little figure again down here showing our rumen development. So that would be around 12 weeks. The rumen is starting to get to almost fully mature. But during this time, calves are going to continue to drink milk from the cow, but they're going to start to actually utilize some of that forage that they're going to be consuming and exploring with. So during this time, we want to make sure they have access to high quality pasture or forage. And really you only need to supplement if the pastures are in poor condition or if you suspect that your cows are not producing enough milk for the calves. By 3 months, calves should be consuming about 1% of their body weight as solid feed. So a lot of times this is going to be pasture, but it might consist of some grain as well if you need to supplement. But reliance on milk is going to essentially decrease as they get older. So something that naturally comes up when we talk about pre-weaning calf nutrition is something called creep feeding. So the goal of creep feeding is to provide supplemental nutrition before weaning. So that's about 60 days before. And it oftentimes will lead to higher weaning weights, and it may help compensate for poor milk production. And we'll talk about instances where we might need to creep feed here in just a minute. There are a couple different options for creep feeding. You can feed high energy or protein supplements. There are special creep mixes out there you can purchase, or you might also be able to creep feed high quality forage that the calves can access, but the cows can't. So if you're not familiar with how creep feeding actually functions, the calves can come in here into a feeder like this, where they can actually access the feeder, but the cows that are too big, they can't actually access the feeder. So you might be asking whether or not you should creep feed, and the answer is that it depends, and it really comes down to economics. It depends on the cost of feed, and that's a big one, especially now with feed costs going up. It depends on forage quality and availability, as well as the value of additional gain. So that's something that you need to be able to think about and calculate on your operation in order to determine whether or not creep feeding would pencil for you. You need to consider feed conversion and feed efficiency of that creep feeding program. And then for and that's something else in terms of a big economics point is calf prices. So how soon after weaning you're marketing your calves, but also if calf prices are high or if they're low relative to previous years. So if you're asking yourself whether you should creep feed, in instances where you might consider creep feeding would be if pastures are in poor condition. So those calves aren't able to consume high quality pasture to support the growth, or maybe that pasture isn't high quality enough for the cows, so they're not producing enough milk. If the cows are in poor condition, you might consider creep feeding to help spare the cow and help her boost her condition score. You might consider creep feeding if calf prices are high or if feed prices are low. And those two are the big ones that you generally want to pay attention to when you're considering whether or not you should creep feed. Calves that if they're being sold shortly after weaning, you might consider creep feeding in that instance as well. Conditions where it probably isn't going to be economical for you to creep feed, where it might not be worth your investment, could include times when pastures are in good condition, cows are in good condition, calf prices are low or feed prices are high, or if you're feeding replacement heifers, or if you're retaining calves for backgrounding. So at the end of the day, the decision really should come down to the potential for economic return. So the big things are knowing your feed costs, as well as the value of additional grain you might get or gain you might get from creep feeding. That should help you make your decision whether or not you should creep feed. And it's not going to be the same for every farm, and it's not going to be the same year after year. So you might find it profitable to creep feed, this year, but next year it might not be. So it's important to assess each year and each season. Another topic that oftentimes comes up is something called preconditioning. This involves preparing calves for the next stage of life. So typically this means preparing them for the feedlot. During a preconditioning program, you're going to retain calves for a period of time after weaning. Some programs are going to vary in length of time, but the minimum is generally 45 days. And during this time, calves are going to be bunk trained. So they're going to be trained to eat from a feed bunk. They're going to be trained to consume solid feed and use water troughs. And they're also going to be going through a vaccination program and also be dehorned and castrated if necessary. The benefits of a preconditioning program is that generally calves are heavier, and they're oftentimes healthier because they've been vaccinated and they've had time to adapt to post-weaning life, if you will. And a lot of times you will receive a premium at sale. So there is some economic incentive to doing a preconditioning program. So like with creep feeding, you should really consider a few different things when you're deciding whether or not you should precondition your calves. Whether or not you should do it really depends on economics, as well as facility constraints and labor constraints. So in terms of economics, you need to make sure you have a market for your preconditioned calves. You need to make sure you're able to keep good records, especially when it comes down to vaccinations. You need to make sure that your calves are uniform. So if you have calves that are born in February all the way through June, a preconditioning program might not be the best approach for you. You need to make sure you're able to afford the additional feed, which is typically made up of a grain. So if you don't have the means or the resources to purchase additional feed, preconditioning might not be the route you want to go. And also the biggest thing is to make sure you understand what your cost of gain is going to be versus the potential price that you're going to receive in return. In terms of facility constraints, that's kind of a big one for some folks. If you don't have the appropriate facilities to accommodate calves, and get them bunk trained and whatnot, or and things like that, you want to make sure that you're able to meet those requirements with your facilities. In terms of labor constraints, obviously a preconditioning program does add an additional group of animals to manage. So you need to ask yourself whether or not you have time for keeping those additional records, so vaccination records and weaning records and whatnot. Do you have extra time to observe the animals? Do you have extra time to manage the feeding that is associated with the preconditioning program? And if you don't have the time, can you afford to hire someone, your neighbor or somebody, to come help you out for a few weeks? So if you can't So if you can't answer yes to those questions, I would recommend you rethink your idea of preconditioning calves. We also don't want to forget about water. So this is the last point I want to touch on with nutrition, is that water is a really important nutrient. And regardless of the animal's age, water access is really, really important. So during those first 2 months, calves are generally going to be just consuming milk from their dam. But it's really important that they do still have access to water, especially if it's really hot out. So early exposure of water troughs can actually help calves learn to use them during and after weaning. And we want to make sure that calves can actually still access the water. Their troughs might be present in the field, but during times of high water use, so when it's really hot, the water level might get drunk down too far, and the calves might actually not be able to physically access the water in the trough, since they're shorter than cows. So some silly little things like that to make sure you're keeping an eye on, especially during the summer months. So next we're going to talk a bit about health. So we're going to start this portion by just briefly talking about the veterinary client-patient relationship. So the AVMA defines this as the basis for interaction among veterinarians, their clients, and their patients, and is critical for to the health of your animal. So in a nutshell, this basically means that you should have a veterinarian and you should have a good relationship with them and make sure that they are familiar with you and your farm and your animals, and that they are going to agree to serve as the primary contact for your animal's health care. It's really, really important to develop a good relationship with your veterinarian, especially with if you're a cow-calf producer and you have cows calving and you have difficult calvings, or if you have a sick calf or you have somebody who gets hurt, it's really, really important that you do have a good relationship with that vet, so that you know if there's an emergency and you call them, they're going to hopefully be able to come, or if it's a practice, they'll be able to send someone out to you. It's also important to have a good relationship with them to help facilitate those routine care procedures. So vaccination programs, castrating if needed, and dehorning as well. So I'm going to go through a couple different aspects of health procedures that occur during the pre-weaning period. The first one I'm just going to go over briefly is dehorning. So dehorning is done because horned cattle pose a safety risk to humans as well as other animals. And animals that are sold at this with horns generally will be discounted. So they won't return as much for you. Dehorning is recommended to be done as early as possible. Generally recommended before 2 months of age if you can. I know sometimes that's not always possible. But that does change how you actually do the procedure. So before 2 months of age, that horn bud, as you can see on this calf here, but if it's done before 2 months of age, the horn bud isn't actually attached to the skull, and it's not as traumatic of a procedure. But after that time, the horn bud attaches to the skull and becomes a much more invasive procedure to remove the horn. There are a couple of different options in terms of how calves are dehorned. The one that is starting to become pretty popular, especially in the dairy industry, is the caustic paste, which you can apply to the horn bud. It basically is a chemical that will use a chemical reaction to destroy the horn tissue, but that has to be used really early on. There's also hot iron cautery, which is pretty popular as well. There are small, gas dehorners. There's also larger electric hot iron dehorners as well. And those basically will use heat to destroy that horn tissue as well. Once the calf is older, so over 4 months of age or so, and the horn is more developed and attached to the skull, other tools have to be used in order to physically remove the horn from the animal. So there's scoops. That's typically what is used on an older animal. The downside of that is that it is not bloodless, and there is risk for infection there. So earlier is always better. The other option is this is not really dehorning, but the other option is to use a polled bull in your breeding program. So for you folks that use Angus genetics in your herds, which a lot of people do, You don't necessarily have to worry about dehorning as much because the Angus breed is polled, which means that those calves don't grow horns. They're naturally hornless. So if you're interested, if you have horned cattle and you really want to get rid of, dealing with dehorning and whatnot, I really encourage you to check out using polled genetics in your program. Another procedure that you're more than likely going to encounter is castration. So bull calves are castrated because intact bulls can be difficult to manage in terms of behavior, but also in terms of logistics. Excuse me, after puberty, it can be, it's difficult to manage bulls as well as heifers at the same time. And then bull calves also incur a discount at sale. So they'll bring less than a steer calf of equal weight. There are a couple different approaches to castrating bull calves. They basically fall into two categories. There's either surgical or non-surgical procedures. The non-surgical ones do not involve any bleeding. And essentially, there's banding, and then there's also the bordizolor masculotome method. So with banding, that essentially has a band that goes around the scrotum and it cuts off the blood supply to the testes. The bordizolor masculotome uses a crimping or a crushing method to crush the spermatic cord to cut off the blood supply to the testes that way. And again, both of those are bloodless. And then the surgical methods generally will utilize a knife or a tool called an emasculator. And some folks really like, the non-surgical techniques because there's no blood, no bleeding, there's less risk for infection. Whereas other folks really prefer the surgical methods because you know for sure that you're removing 2 testes to make that bull calf a steer. When should you castrate? Again, with dehorning earlier is better. If you're using banding, it's generally recommended to you do that by 1 week within the first week or so to make sure that the band tension has enough to actually cut off the blood supply to the testes. Where the other methods, it's recommended to do it by 6 months. Again, but earlier is better. So, and even the Beef Quality Assurance Program does recommend within 90 days if possible. I know sometimes it can be difficult if you're considering keeping a calf for breeding purposes, but ones you're surely not going to keep for breeding should be castrated as early as possible. This figure here is just showing the negative implications of castrating at later ages. So if calves are castrated at 0 or months or right at birth, there's practically no change in average daily weight gain. If they're castrated at 2 months of age, generally you'll see a drop of about 0.2 pounds per day of gain, per day during that first 30 days after castration. If they're castrated at 4 months, you'll generally see a drop of about 0.4 pounds per day of gain. Again, and that's through the first 30 days after castration. So you'd see a pretty dramatic reduction in gains as you increase the age at which the procedure is done. So my recommendation to folks who are interested in learning these procedures for yourself is to work with your veterinarian to learn the proper technique, especially if you're going to be doing surgical methods, just to make sure that you're not creating a risk for infection. Another topic that comes up in terms of calf health is vaccinations. So in terms of vaccinations for calves, there's sometimes some confusion in terms of what's recommended as well as the timing. And the timing really depends on your management system and how often you want to handle your calves before weaning. But generally we recommend a set of vaccinations before weaning and then a booster at or after weaning. And the ones that we recommend are going to be those the colostridial vaccines. So that's generally a 7-way vaccine, as well as the respiratory vaccines, which include BRSV, IBR, BVD, PI3. That generally comes together as a respiratory complex vaccine, as well as Pasteurella. If you're selling breeding stock across state lines, as Jeff informed me, you have to make sure that your replacement heifers are vaccinated for brucellosis. But if you're not doing, if you're not selling them across state lines, you don't necessarily have to vaccinate your replacement heifers for brucellosis in Maryland. Optional vaccines include pink eye as well as anaplasmosis, as directed or as suggested by a veterinarian. The pink eye vaccines are kind of hit and miss, and I think it's important to impose proper fly control procedures in order to prevent pink eye in the summertime, because that's oftentimes a big source for pink eye. So the vaccine can't be used as a Band-Aid for fly control. In terms of a vaccination schedule, as I mentioned, that can really be dependent on your management system and how often you want to work your calves. So it's a good idea to talk to your veterinarian, see what they recommend, and then also work that into your management system. So this is just an example schedule that's shown here, where the calves are worked 2 times prior to weaning. So the first time they're being worked around 2 to 3 months, and they're getting that respiratory complex as well as the clostridial vaccination and pasturella. And that 2 to 3 month window, calves could also be, getting dehorned, they could be getting castrated and what have you, doing those other procedures that need to be done. And then with this program, again, they're getting boosters of everything at 48 weeks before weaning. And then at weaning, they're getting a booster again of that respiratory complex. So again, that's going to depend on your farm management system and how often you want to work your calves before weaning. So getting into weaning, I'm just going to go through a couple of different strategies that folks do use and to actually wean their calves. But the important thing I want to remind you of is that weaning involves 2 major stressors. And the first is the removal of their primary nutrient source, so that's milk. And it's also, the second is the removal of the cow. So you're removing that their primary, their dam. So weaning is considered, because of those 2 things, weaning is considered to be one of the most stressful events in a calf's life. So we want to make sure that we keep that in mind when we're, thinking about weaning, and we want to make sure that we're not going to be combining weaning with other stressful procedures, like a new environment or shipping, if we can avoid it, and things like that. We know from, personal experience, I'm sure, when you're stressed out, your immune system goes down. So if, weaning calves can predispose calves to illness if we add too much stress to their program. We want to ensure that during the weaning process, calves have ample access to high quality and palatable feed or water. We also want to make sure we're observing them each day to make sure that they're acting normally, eating and drinking. Obviously, they're not going to be eating a ton at the feed bunk because they're probably going to be a little bit stressed out, but we want to make sure that they are exposed to the feed bunk and they know where they can get feed from, or if they're in pasture, that they are grazing some. And we want to make sure that they're acting normally, so they're not isolating themselves or anything like that. And then during weaning, we also want to make sure we're watching for signs of dehydration, because that can happen pretty quickly for a calf that's just pacing the fence, not really, looking for its dam, but not really, drinking. Before weaning, we want to make sure we're administering some pre-weaning vaccines. Again, we don't want to be giving them their first dose of vaccines at weaning if we can avoid it, because vaccination does impose a little bit of stress on the immune system. And if you add that to weaning, it can overwhelm the calf, but it can also possibly reduce the effectiveness of the vaccines. We want to try to familiarize calves to their post-weaning environment as much as possible. So that would include feeders, waterers, and things of that nature. In a perfect world, you would move the cow-calf pair into the field or facility a few days before weaning, and then remove the cows from the calves and not vice versa. And that way the calf has some time in that area to acclimate itself in the company of its dam, and then you remove the cow from the picture, and then at least the calf knows where the water is and where the feeders are. You also want to make sure that during this time, calves have access to vitamins and minerals to help support their immune system. There are a couple different weaning strategies employed. The first one is traditional weaning, which involves complete abrupt separation of the cow and calf. With this procedure, generally there's a lot of vocalization and fence line walking by both cows and calves for up to 3 days. And then sometimes this traditional weaning procedure is combined with shipping. So cows and calves are separated and the calves are marketed that same day. If you can avoid that, we recommend that you do, because again, shipping is a whole nother layer of stress that they'd be adding to the calf during this time. But sometimes we realize that that's not always practical. So one of the alternative weaning strategies that's gaining in popularity is something called fence line weaning, where calves are separated from their dams by a fence for about a week. And then after that, calves will be completely separated altogether from visual and auditory ability to hear the dam or see the dam. So with this procedure, typically you have less vocalization, less fence line walking, and better gains in the calves. So there are a lot of pros to this system. However, there is a lot of extra time and labor required. And you also need to make sure that you have a permanent fence structure for separation of the cow and the calf. And a lot of times logistically, this setting this up can be challenging as well. So that is so those are some of the reasons why not everybody is doing this procedure and using fence line weaning. The other alternative weaning strategy is something called two-step weaning, where basically the idea is to separate those two major stressors from one event into two different events. So the first thing you'll do is prevent the calf from nursing. So you remove the milk stressor, and then a week or two later, then you remove the calf. You separate the calf and the cow, and that makes that second stressor separates out those two major stressors. So with this process, you use a plastic nose piece and put it on the calf, and that helps prevent the calf from nursing. And that allows the calves to, and then you would allow the calves to remain with their dams for about 2 weeks, and then you would separate them completely. Compared with traditional weaning, this process results in less vocalization and less fence line walking, but there's really no consistent advantage related to growth. So unlike fence line weaning, this procedure doesn't always improve the gains of the calves. And so there's really not as much support for this procedure in terms of a return for the producer. There's also an added cost for the nose pieces, and then you also have to make sure that you're checking them each day to make sure they're still in place, because they can fall out. And it's also additional labor is required because you do have to handle these calves to place the nose pieces initially, and then if they ever fall out, you have to run with the chute and put them back in as well. So to finish up tonight, I just want to talk a little bit about caring for orphan calves. Unfortunately, at some point or other, more than likely you're going to have at least one calf that, the cow dies or something happens where it doesn't have a cow to nurse with, and you're not successful in grafting that calf to another cow. So when that happens, you should be prepared to take care of it. So generally for an orphan calf, we're going to feed milk replacer. 20-20 is fine. So that means, 20% protein, 20% fat is fine. And you're going to feed that calf twice daily from 1 to 2 days old until 6 to 8 weeks of age. So after those first 2 colostrum feedings, that's when you would put that calf on a milk replacer. It's important that during this feeding period that the calves have daily access to fresh water and a starter grain, and I'll explain why in just a second. But a starter grain is basically a grain that is either pelleted or texturized, as shown here, but it's about 16 to 20% crude protein. And it's important that these calves start to consume that grain because it does help jumpstart rumen development a little bit earlier than our our traditionally raised calves. The goal for rearing an orphan calf should be to have it eating at least 1.5 to 2 pounds of solid grain per day before you initiate weaning. So we have here that you can wean at 6 to 8 weeks of age if they're eating 1.5 to 2 pounds of grain a day, but you don't have to necessarily wean that early. If you'd rather feed them milk replacer for longer, you're more than welcome to do that, but milk replacer is expensive. So that's why there is a little bit of motivation to wean earlier, as long as grain intake is adequate. In terms of feeding, actual feeding, you can feed the calf using a bottle or a bucket. There's really no requirement for either. There's no advantage of feeding a calf out of a bottle versus a bucket, and it doesn't really impact their performance in any way. In terms of feeding rates for the milk replacer, you should follow the instructions on the bag in terms of how much powder as well as how much water to mix with that powder. It's important to use warm water when you're mixing up the milk replacer, because it does help it mix up a little bit easier. After feeding, it's important to clean anything that touches milk replacer with soap and water, because that does make a nice environment for bacteria to thrive. If a calf doesn't drink all or most of its milk during one feeding, it's not necessarily a huge cause for concern, but if it happens more than one feeding at a time, it's critical to check for signs of illness because that calf might be getting sick. When you go to wean a bottle calf, you generally want to, again, wait until the calf's eating between 1.5 to 2 pounds of grain a day, which can be accomplished by 6 to 8 weeks of age. When you go to actually do the weaning process, we recommend to decrease to 1 milk feeding a day for a week, and then remove all milk feedings altogether after that first week. And then after weaning, it can be a little bit tricky in terms of managing these calves. Some folks will keep them separate for a while. Some will try to commingle them with other calves or with the cow-calf herd. It can be tricky doing that because one, the calf might try and nurse a cow, but it can be difficult to make sure that calf is getting adequate nutrition if it's just out in the pasture and it's used to eating some grain. So a lot of times it is beneficial to keep them separate for a few months before you try to commingle. And when you do commingle the orphan calves with the rest of the group, you're going to make sure that they are used to the feed that they're going to be receiving. They know where the water troughs are, and that they are otherwise equipped to integrate with the rest of the herd. And then especially during these initial weeks after commingling, you want to make sure that you're observing them closely to make sure that they're eating, make sure that they're drinking, and there's nothing serious going on with them. So some final thoughts for tonight. Just want to make sure we mention that there's no one size fits all management system for everybody. So what works for you might not work for your neighbor. And what works for you this year might even, not work for you next year. So there is no one size fits all system. There are 2 major critical times in a calf's life, and those times are the first 24 hours and as well as weaning. So I want to make sure we're paying special attention to calves during these times. And it's important to make sure that we're checking calves and cows at least once a day for abnormal behavior, but also to make sure that they're all eating and drinking. I know that seems kind of obvious, but sometimes if we're busy, things can get overlooked. So with that, I thank you for hopping on tonight. And if you have questions, please put them in the chat box. You can reach myself, Rachel, or Jeff at our email or our phone numbers listed here. So thanks a lot.
Great job, Sarah.
Yep, that was very thorough. Good job.
I can send you the form that Jonathan uses to put stuff on the website, and he'll just upload everything.